This training will review the school-located influenza vaccination program's standing orders for the management of acute adverse reactions. Vaccinators, public health nurses and registered nurses responsible for overseeing and managing adverse events post-vaccination, and clinic managers, must review, understand, and adhere to the Stop Flu at School program's standing orders for inactivated influenza vaccine and the protocol for the management of acute adverse reactions to vaccines. SFAS personnel must be aware that recipients may experience an adverse reaction following immunization which can be life-threatening. Staff need to be prepared to recognize and respond immediately and appropriately if an adverse reaction should occur. When assessing persons with possible adverse reactions post-vaccination, follow basic first aid and initial assessment procedures. Check their vital signs: airway, breathing, including both their respiratory rate and air movement, and circulation, including pulse and blood pressure. Evaluate their level of consciousness and appearance. Are they alert? Do they appear comfortable? Are they able to speak? Do they seem anxious? Persons that are anxious when receiving a vaccination may hyperventilate. Symptoms of hyperventilation include rapid breathing with good air movement, no wheezing or stridor. The patient appears anxious, but not tired or pale. They may complain of lightheadedness. They may have weakness, numbness or a tingling sensation in the arms or mouth. They may have muscle spasms in the hands and feet. To manage hyperventilation, make sure the airway is clear. Instruct the patient to sit or lie down and slow down their breathing. Have the patient breathe into a paper bag to correct the hyperventilation. Provide support and reassurance, and monitor the person until the episode subsides. Symptoms of lightheadedness include fright before the vaccination is given, complaints of feeling faint, dizzy, or tired. The patient appears pale. He or she may be yawning. The pulse is steady, and there is no respiratory distress. To manage lightheadedness, have the patient sit or lie down for the vaccination. Have the patient lie flat or sit with their head between their knees for several minutes. Loosen any tight clothing and maintain an open airway. Check their vital signs, including pulse, blood pressure, and respirations. And apply cool, damp cloths to their face and neck. Symptoms of syncope or fainting may include extreme paleness, sweating, cold hands and feet, nausea, lightheadedness, dizziness, weakness, visual disturbances. The person should be breathing normally. Respirations may be shallow, but there should be no respiratory distress. Pulse is regular. They may fall without loss of consciousness, or they may lose consciousness. To manage fainting, have the patient lie flat or sit with their head between their knees for several minutes. Loosen any tight clothing and maintain an open airway. Check their vital signs, including pulse, blood pressure and respirations. Apply cool, damp cloths to their face and neck. If the patient loses consciousness, examine to determine if an injury is present before attempting to move the patient. Place the patient flat on his or her back with feet elevated. Call 911 if the patient does not recover immediately or if an injury is present. Once consciousness is regained, observe the patient in a quiet area until they are asymptomatic, for a minimum of 15 minutes. Severe, life-threatening anaphylactic reactions following vaccination are rare, estimated at about 1 in a million doses. Anaphylactic or allergic reactions may be due either to the vaccine or a vaccine component and may be severe and life-threatening. The risk of an allergic reaction can be decreased by thorough screening for contraindications and precautions prior to vaccination. However, even with careful screening, reactions may occur. Staff, public health nurses, registered nurses, And clinic managers should be familiar with the signs and symptoms of anaphylaxis, because allergic reactions may begin almost immediately after vaccine administration. Anaphylaxis requires rapid recognition and treatment to prevent progression to cardiovascular collapse. Signs and symptoms of anaphylaxis can include but are not limited to generalized hives, itching, erythema or redness, or flushing, swollen lips, face, throat, tongue, or uvula, shortness of breath or dyspnea, wheezing and bronchospasm, stridor, hypoxemia, abdominal pain or cramping, vomiting, diarrhea, reduced blood pressure, syncope or fainting, cardiovascular collapse, hypotonia, and incontinence. Every clinic must have an emergency kit containing epinephrine, both auto-injectors and aqueous epinephrine in vials, diphenhydramine, supplies for administering medications, child and adult blood pressure cuffs, stethoscope, pediatric and adult resuscitators, and other supplies. If a patient has symptoms or signs of anaphylaxis, call 911 immediately. Assess their airway, breathing, circulation, and their appearance and level of consciousness. Place the patient in a recumbent position. Make sure their airway is clear. Use manual resuscitator if necessary. If no pulse, begin CPR. The first and most important therapy in anaphylaxis is epinephrine. There are no contraindications to epinephrine in the setting of anaphylaxis. Each emergency kit will have a pediatric and an adult epinephrine auto-injector that may be used for rapid administration of the initial dose. Administer aqueous epinephrine 1 to 1000 intramuscularly. The dose for epinephrine is 0.01 ml per kilogram per dose. If the weight is known, then dosing by weight is preferred. If the weight is not known or not readily available, a chart included with the standing orders and in the emergency kit has approximate dosages for children, based on age and weight. The maximum dose for children is 0.3 milliliters. The maximum dose for adolescents is 0.5 milliliters. For generalized hives or itching, diphenhydramine may be administered by intramuscular injection at a different site than that given for the epinephrine. The standard dose is 1 to 2 mg per kilogram, with a maximum single dose of 50 mg. If the weight is known, then dosing by weight is preferred. If the weight is not known or not readily available, a chart included with the standing orders and in the emergency kit has approximate dosages for children, based on age and weight. The patient should be monitored closely until EMS arrives. Perform CPR or assist with respiration if necessary. Keep patient in a supine position, flat on their back, unless the patient is having breathing difficulty. If breathing is difficult, the patient's head may be elevated, provided blood pressure is adequate to prevent loss of consciousness. If blood pressure is low, elevate the legs. Monitor vital signs every 5 minutes. If EMS has not arrived and symptoms are still present, administer epinephrine dose intramuscularly every 5 to 15 minutes or more frequently as necessary to control symptoms and maintain blood pressure, up to 2 times after the first dose for the treatment of anaphylaxis. Monitor and record all signs and symptoms, vital signs, medications administered, including the time, dosage, site, response, name of person who administered the medication, and other relevant clinical information. All patients showing signs and symptoms of anaphylaxis, regardless of severity, should be referred to a hospital or emergency facility for treatment. If EMS is called and the student is transported to an emergency facility, the PHN or RN responsible for overseeing and managing incidents and adverse events post-vaccination must complete the referral to emergency facility form, in addition to the incident adverse event reporting form. A line has been added to this form. In the event that the clinic manager is not a public health nurse or registered nurse, this form must be signed by the PHN or RN responsible for managing incidents and adverse events, in addition to the clinic manager. The Incident Adverse Event Reporting Form has been revised to assist in documenting information related to the event. Person completing report has been changed to public health nurse or registered nurse completing report. This form must be completed by the PHN or RN, managing the incident or adverse event. The former likely cause of incident section has been replaced with a section to document vital signs. Vital signs must be recorded for persons with symptoms and signs of dizziness, syncope, or anaphylaxis. A disposition section has been added to document the PHN or RN's assessment of the student's appearance prior to release from the clinic to EMS personnel, the health room, parent, or classroom. A note has been added to the bottom of the form to clarify that if the clinic manager is not a PHN, the form should be reviewed and signed by the public health nurse or registered nurse overseeing incidents and adverse events, in addition to the clinic manager. When should you complete an incident adverse event reporting form? Fill out the form for any adverse reaction, including lightheadedness, headache, or itching, any person who was vaccinated twice, participants with contraindications who received vaccine, mistaken identity of participant, anyone who received the vaccine using another person's consent form. Document any incident or unusual occurrence. Please include a copy, not the original, of the consent form with the incident report. Please complete all reports on the day of the incident, so that the details are fresh in your mind. But don't feel as if you must complete the incident report during the clinic. It is fine to return to your office to complete the report. If you complete the incident report prior to the end of the vaccination clinic, you may submit the report with the consent forms to the immunization branch. If the report will not reach the immunization branch on the day of the incident, please fax the report to 808-586-8312. Please be aware that incident reports and forms may be read and reviewed by upper management and by agencies and individuals outside of the Department of Health. Please remember, when documenting incidents, be thorough, but succinct. Be specific. Be objective. Be professional. This form includes several common errors that are noted on the incident adverse event reporting forms. The form is missing information, such as the student's date of birth and the school name. In this example, vital signs were not recorded, even though the student complained of dizziness, vomited, and was noted to be diaphoretic and pale. Action taken, only states gave water. No other actions documented. The final disposition is blank. No documentation of student's condition upon leaving school with his parent. In this example, vaccine leaked out of the syringe during administration of IIV. This form is marked parent contacted, no. In this situation, or in any situation where student does not receive a full dose, for example, if the student moved during administration, the parent must be contacted for permission prior to attempting a repeat dose. Now we will review the procedures for responding to blood-borne pathogen exposures. If a person is exposed to blood-borne pathogens at a school-located influenza immunization clinic, treat the exposure site immediately. Wash needle sticks, cuts, or affected skin with soap and water. Flush splashes to the nose, mouth, or mucous membranes with water. Irrigate eyes with clean water, saline, or sterile irrigants. Report any blood-borne pathogen exposure to the PHN or RN responsible for overseeing and managing incidents and adverse events, and the clinic manager. Any person exposed to blood-borne pathogens at the school-located clinics should immediately seek medical treatment. Contract personnel should be referred to their employer. Military personnel should be referred to the Department of Defense. Public Health Nursing Branch staff should be referred to the PHN branch. Medical Reserve Corps should be referred to the MRC coordinator. Kaiser personnel should be referred to their employer. The PHN or RN responsible for overseeing and managing incidents and adverse events should record the circumstances and post-exposure management on the Incident Adverse Event Reporting Form. The Incident Adverse Event Reporting Form should be signed by the PHN or RN and the clinic manager. The report should include the date and time of exposure, post-exposure management, details of the procedure being performed, including where and how the exposure occurred. If the exposure is related to a sharp device, include the type and brand of the device, and how, and when, in the course of handling the device the exposure occurred. Include details of the exposure, describing the route, for example, mucosal, percutaneous, etc., type and amount of fluid or material, and the severity of exposure. Provide details about the exposure source including the name and parent or guardian's name if the source is under 18 years of age, address and telephone number. List the exposed person's name, address, telephone number, hepatitis B vaccination dates, and vaccine response status. Call the DOH immunization branch to report the exposure. In what situation should a parent be called? If students have a consent form but state they've already been vaccinated, contact parent to confirm. Student pulls away during administration and receives no dose, or only a partial dose, contact parent to ask if they would like you to attempt vaccination again. If unable to contact parent, do not revaccinate. Questions left blank on the consent form. If clinic is busy, no need to call, but student should not be vaccinated. Contraindications, to explain that student will not be vaccinated. If clinic is busy, no need to call, but student should not be vaccinated. Date of parent or guardian's signature is missing. If parent contacted, document verbal consent to date the form. The PHN or RN responsible for overseeing and managing incidents must contact parent for any adverse event. And any time a repeat dose is necessary, to request permission to revaccinate. Students with adverse events post-vaccination at a previous stop flu at school clinic will be listed on a green sheet, which will be packed with the ICS forms. The list will include the names of students who should not be vaccinated at a stop flu at school clinic and those who may only be vaccinated with a doctor's note. These students will be noted with an asterisk. This concludes the Stop Flu at School Adverse Events training. Please document your completion of this training on a sign-in sheet. If you have questions regarding the content of this training, please contact the immunization branch at 586-8300 on Oahu. Calls from the neighbor islands are toll-free at 1-800-933-4832 or email schoolflu.helpdesk@doh.hawaii.gov. Thank you for watching this video. Your work as clinic managers is invaluable and much appreciated. Thank you for supporting the Stop Flu at School program.